Hello, Dr. Padurean. It's nice to be here with you in Vienna. We're going to do a short interview for about 10 minutes. So can you tell me a few words about yourself, your role in the delegation, and your background?
Hello, Diana. It's nice to be here in Vienna. Well, I'm a fourth-year neurosurgery resident in Cluj-Napoca. And I think my role in this delegation is to provide my part of advice and my point of view, from a neurosurgeon's point of view, on how neurotraumatology must be dealt with in the short term and also on the long-term follow-up. I think this is going to be my role in our delegation.
Can you tell me a bit about your focus in your practice as a doctor?
Well, my focus regarding neurotraumatology is definitely to improve patient outcome, even for patients that require a neurosurgical intervention, but mostly for patients that, so not only for patients that do not require a neurosurgical intervention, but also for patients that must be operated on, because the post-op period for these patients is a very critical one, and it's almost as serious as the injury itself.
So what motivated you to get involved in research regarding neurotrauma?
Well, I think this is one of the first opportunities that I've been given to get involved in a multidisciplinary team, because so far everything that I've done since I was a student and a younger resident was only involved in neurosurgical circles. And this is for the first time that I've been invited on a multidisciplinary team. And I'm really interested to get involved, because there's a really big issue regarding neurotrauma patients, especially neurosurgical ones.
Are you satisfied with the management of neurotrauma in your country? And do you have any suggestions?
Well,
how could be improved?
It depends on what segment we're referring to. I mean, the neurosurgical interventions are quite standard all around the world, but the follow-up, that's totally different, and the guidelines for pre-op and for the post-op period are very different. So I can't say I'm actually satisfied on how patients are being rehabilitated after neurosurgical intervention, and that's why I think that we're all gathered here to try to improve this.
Could you maybe share and describe an example of a good practice regarding neurotrauma in your specific institution? Maybe something that should be implemented in others?
Well, I think that a very good practice in a neurotrauma patient is basically involves a lot of collaboration between the neurosurgeon, the anesthesiologist, and the neurologist, apart from the entire auxiliary medical team. Now, a successful neurotrauma case, well, it's hard to describe a successful neurotrauma case, because a case can be successful depending on the injury or not. But usually if a patient has a serious brain injury, I mean, the things that give the patient the biggest chances of survival are acting really quick on the injury, if it has a neurosurgical indication or not, and the follow-up period. And it's really important that everyone takes care of the patient and realizes that he needs to have 100% attention from the entire medical team.
And could you highlight some of the main challenges in the treatment and research in your country when it comes to neurotrauma in your institution?
Yes, we don't have specific rehabilitation centers for specific neurotrauma patients. We have ICU units in which we treat all our patients, but we don't have specific centers or specific areas to treat and to rehabilitate neurotrauma patients. And this is a very important factor because they need a lot more care than, let's say, a different patient with a different pathology that ends up in the ICU. And I think this is one of the biggest challenges. And since we cannot keep the patient in the ICU for a very long period of time for rehabilitation, because beds are very limited and the emergency cases are very high in number, we don't have specific places where we can send the patient, apart from some private centers which are unfortunately are beyond the possibilities of the regular patient.
In this case, could you describe some innovative approaches or applications that could bring substantial change in the treatment of neurotrauma?
I don't really think that we need innovative approaches. I think we all have to do what we are here to do and actually gather around the table and talk, neurologists with neurosurgeons, and try to see what we can do together. So I don't think there's some kind of secret or some kind of innovative approach or some kind of discovery that we need. We just need to get together and agree on the guidelines, and not only neurosurgeons and neurologists from the same country, but from most countries. If that would be the best case scenario, to have universal guidelines for the treatment of neurosurgical trauma. And yeah, I think that's what we actually need.
What is your opinion about an international TBI registry and how it could impact the management of TBI?
It's a beginning. It's a positive beginning, but I think it's a long way until we can actually use the results. And if we want it to be an international TBI registry, then we actually have to gather information from a lot of countries, and not just a few high-income countries, and that's it. So we need this registry to be actually international, and we need to have results that can be applied in all the countries that are participating in this registry.
In your opinion, what are the most important quality indicators in neurotrauma care?
I think that the most important quality indicators, if you're referring to the patient's quality of life, I think the best indicator is the gravity of the first injury. But if we're talking about the long-term follow-up, then I think one of the best indicators are having a specific multidisciplinary neurotrauma team, which at the current moment does not actually exist in most countries.
And as you said, the multidisciplinary team is important in TBI management.
I think it's the most important.
From your point of view, what specialists should this team include?
Should what?
And why? So a multidisciplinary team should include people from different specialties.
Yes.
Who do you think should be in that team, and why?
Well, first of all, an emergency medicine doctor, because they are usually the first ones who arrive at the scene of the injury, and the ones who receive the patient firstly. then we should obviously have a neurologist, a neurosurgeon if the patient needs to be operated on, and also a radiologist, a good radiologist. And well, I think this would be a sufficiently good beginning, something to start with.
From your point of view, which are the main obstacles in terms of collaboration in this team?
Well, in terms of collaboration, well, one of the obstacles is probably that we don't, we're probably too busy with our own how can we call them, our own problems, with problems regarding purely neurosurgical or neurological issues. And I think it's quite difficult because we're not so, it's not so handy for us to communicate to someone from a different specialty as it is to communicate with someone from our own specialty. So I think this is one of the main challenges. The fact that we need to get by this difficulty of communicating with someone from a different specialty and with someone who doesn't actually understand your problems, and you who do not understand 100% their problems.
Could you identify 3 of the strongest and 3 of the weakest points in research in neurotrauma these days?
I will try, but 3 of the strongest points in research, as in, well, one of the strongest points, that I've seen so far is this simulation center right now, because so far, as I've told you before, I haven't seen only neurosurgeons collaborating with neurosurgeons and neurologists with their kind. I think this is one of the strong points. Another strong point is international collaboration, and the fact that we've gathered here at this simulation center. There are not only high-income countries or middle-income countries, but also low-income countries, and I think this is crucial to trying to establish some guidelines and provide something of genuine quality in providing neurotrauma care. Because if only high-income countries talk with other high-income countries and they develop their guidelines, they won't be able to implement them in lower or middle-income countries. So this is very important. Now, one of the weak points is the fact that we have to travel to do this and get out of our comfort zones. This is one of probably one of the weakest points. The fact that we have to exit our regular our daily routine and think of something different, something that is not easily palpable, something that we won't see the results of immediately. And I think this is the weak points. The fact that it's a very long-term ambition, something that we won't see the fruits of in the short term, in the near future.
How do you feel about an online community for those interested in neurotrauma? Do you think it would be helpful for medical practice?
On the online community as an auxiliary, to complement face-to-face meetings, because an exclusively online community, in my opinion, I don't think it would be able to achieve any to achieve something durable. So an online community, I think, is helpful, but this has to come after a few face-to-face meetings and actual fact counting and discussing the things and discussing the issues, live.
Which do you consider to be the main challenges in preventing neurotrauma?
Well, one of the big challenges is the one I see every day, and the ones that you probably see every day. A lot of cyclists everywhere not wearing helmets. So this is one of the biggest challenges. You cannot convince people to properly wear cycling helmets, and this is the case for low, middle, and income and high-income countries. And I think, it's such a basic thing. We have so many cyclists, and getting a helmet is not really that big of an effort, but people still don't do it. And I think this is one of the big challenges, trying to convince people that these measures are actually useful. And apart from wearing a bike helmet, you can also think of wearing seat belts. Yeah, so I think the biggest challenges are to try to convince people that taking these safety precautions can actually make a huge difference in your outcome in the case of an injury.
What is the impact of COVID-19 over the neurotrauma management in your country? For example, when it comes to the caseload?
Yeah, the COVID pandemic definitely had a big impact in neurotrauma management, but I think it had a bigger impact in treating chronic disease, because the advantage, so to speak, of being a neurotrauma patient is that you would be treated upon if the patient required surgery, in our case, no matter if you were a suspect of having COVID or you were a COVID positive patient. So neurotrauma didn't suffer that much from the pandemic, because the neurotrauma patients were high priority patients, or emergency cases. But I think the COVID pandemic had a huge and a much bigger impact on the chronic cases opposed to the neurotrauma cases.
Are you familiar with the AMN organization, or have you ever participated in any of the congresses?
No, actually this is the first time I've heard of the AMN, and I haven't participated prior to this in any of their activities.
Well, that was it. Thank you for your time.
Thank you. Thank you as well.
Enjoy the experience.
I will. Thank you.